Sulit o hindi ba komportable ang intimacy? It's not only in your mind, mga kasambahay. Maaaring vaginismus na yan. Naku, hindi ito dapat ikahiya at may mga paraan para ito ay makonquer. Kaya tara na, alamin dito lang sa Doctors on TV. Ang kwento ng vaginismus ay hindi lang tungkol sa sintomas, kundi puno rin ng makasaysayang debate mula po sa mga lumang teorya hanggang sa mas makabagong pag-unawa. Naku, kaya tara, mas laliman pa po natin ang ating kaalaman. Let's watch Dose of Information.
Alam mo ba, noong 1861, si Dr. James Marion Sims ang nagbigay ng pangalan sa vaginismus. Ito ang involuntary na paghigpit ng muscles sa vaginal area na sobrang sakit. Noon, ang paniniwala niya, operasyon lang ang solusyon. Mabilis itong kumalat sa France, pero maraming doktor doon ang kumontra. Sabi ng iba, matagal na nilang alam yan. Ang iba naman, tingin nila psychological at hindi dapat idaan sa surgery. Kaya sa huli, ang Sims Operation for Vaginismus ay naging simbolo ng isang American style na sobrang direkta at physical ang approach at hindi ito lubos na tinanggap ng French medical community.
Look, mga kasangbahay na mula po sa pagkakalapit ng isip at katawan hanggang sa mga kondisyong kagaya ng vaginismus na naapektuhan ang buhay at relasyon ng isang babae. Naku, at ngayon po, mas malinaw na sa atin ang kasaysayan nito at ang mga naging debate sa paggamot noon. Nananatili pa rin ang tanong ng marami, ano nga ba ang dahilan nito at paano ito maaayos? Naku, kaya ngayong umaga, mas lalaliman pa natin ang pag-uusap tungkol po sa vaginismus. Kasama ang isang magaling na Obstetrics and Gynecology Specialist from Makati Medical Center. Welcome to Doctors on TV, Dr. Jennifer Marie Jose.
Hi, hello, good morning.
Hi, Dr. Jenny. Welcome to Doctors on TV. And baka simbatiin mo ng ating mga viewers.
Hi, hello, good morning everybody.
Yeah, doktora, ang ganda ng aura nyo ngayong umaga. Okay, so maganda pag-uusapan natin mga kasambahay. Ito, doktora, no? Ano nga po ba ang vaginismus at saka paano ito naiiba po dun sa ibang kondisyon na nagdudulot po ng pelvic pain?
Pelvic pain, okay. Well, ano ba talaga anong vaginismus? Vaginismus, ito yung involuntary contraction ng pelvic floor muscles because you have this fear na magkakaroon ka ng pain during penetration. It's actually very common, you know. Well, I think because now a lot of the patients or the people that you come and see in the clinic, they have this social media and also, of course, the internet where they can research. And they're more open now. That's why dumadami na ngayon ang mga patients na may ganitong concerns.
Yeah. Doktora, I would like to reiterate yung sinabi mong term kanina, involuntary. Ibig sabihin, hindi mo kontrolado.
Hindi mo kontrolado.
Okay. So,
yes.
and it happens during penetration dahil
yes.
Hindi kontrolado yung pag-contract ng mga muscles dyan sa may...
Right. Actually, ang muscles na nasa may puwerta.
Sa may puwerta.
Right.
So, basically, kung mag-contract, di ba matigas yan, doktora?
Yes.
Okay. So, teka, ano ba ang mga karaniwang sintomas po na, maaaring nararanasan ng isang babae na may vaginismus?
Okay, usually magkakaroon sila ng pain, no? Or ayaw nila makipagtalik because it's going to be very painful. Number 2, yung iba, pwede silang may infection doon. Siyempre, ayaw nilang mapagalaw doon. Yung iba naman, not necessarily na magi-intercourse sila, no? But let's say, magpapa-pelvic exam sila. Let's say they will go to a gynecologist. Even just putting the speculum in. You cannot put it in or even just putting a tampon. Those things hindi nila magagawa because of so much pain and fear that they will contract yung pelvic floor muscle. So, walang nangyayari.
Okay, but if this happens during penetration, doktora, can this happen, say for example, same couple, diba? That's what we want naman dalagang isa lang ang partner mo, no?
Right.
So, I mean, can it happen again in another episode, for another episode?
Yes.
Or parang, kasi ang may problema dito ang babae, diba,
Yes.
doktora?
But you see, when you have this problem, it's not only because it's psychological. natatakot yung babae to have that intercourse or yung penetration during sex, right? But actually, it's not only the fear, but you can also have problems down there. You know, you can have, let's say, like what I said, pwedeng infection, pwedeng kang menopause, you're very dry, it's going to be very painful when you have the penetration. Or, you know, sometimes you'll be surprised. Let's say you sit in the office for a long time, and then mali yung upo mo, pwedeng mag-contract ang pelvic floor muscles mo, and then penetration is not possible because of too much pain.
Okay. Hindi kasi natin tinanong kasi, di ba, siyempre minsan merong mga kakaibang relasyon din also that na parang basically hesitant silang gawin.
Right.
Okay, o kaya parang pwede nga takot, mahuli. May mga ganyang mga pangyayari. So, kaya good that you mentioned about na this is not solely psychological
It's not.
of etiology.
Yes, right.
Okay.
Because like in my practice, I'm a gynecologist. I'm an aesthetic gynecologist. I deal with the gynecologic concerns. Pero yung psychological concerns ng mga patients na may vaginismus, I definitely refer to psychologists and psychiatrists because it has to go hand in hand.
I see. Okay. So, as I can see, this is multifactorial, Doktora,
Yes,
no?
yes.
And usually, what are the most common causes bakit nagkakaroon ng vaginismus ang isang babae?
Okay, normally, you know, usually meron silang fear or they had trauma when they were kids. Sometimes, you know, because of course we are in a very Catholic country, how we are taught by our parents, so sarado yung isip nila niyan na when they have like intercourse, it's a sin. So they don't want to do it, right? And like what I said, yung sinabi ko kanina, pwedeng merong discomfort because merong infection, may irritation. Magugulat kayo kasi sa clinic ko ngayon, hindi na mga kabataan ang nakikita ko na let's say from 18 to 25 or in the reproductive age group. Now, I see more women in the perimenopausal to the menopausal group.
Pero menopausal around 43 up.
Yes, usually mga Filipinos nagme-menopause at 48 eh.
48.
No? So 48 up. What happens is that because of the change in the hormones, they become very dry down there and therefore it's painful.
Kanina, before we even started, you gave me like a statistic of you know, vaginismus in your
Yes,
practice. So,
right.
What was it, Doktora?
Well, I'm seeing, let's say, 3 in a week.
So it
That's
means
a lot.
that's really common, diba,
It's
Doktora?
common.
Okay, and considering na hindi lagi itong napag-uusapan, hindi ba? Okay, so and meron bang may role din, diba sabi niyo trauma? Okay,
Yes.
so like meron bang pwede rin kasi yung negative mga sexual experiences in the
Yes,
past?
yes.
That's why nagkakaroon ng development ng ganito.
Maraming ganun din. Kaya yun ang unang tinatanong ko eh. Bakit ka nagkakaganito? Meron ka bang trauma before? Usually iba meron as a child, right? But most of the time, because, you know, I'm also a urogynecologist, I deal with elderly women, usually ang complaint nila sa akin is actually they're dry. But sometimes when they come to the clinic and they are a couple, alam ko na, may problema sila. You'll be surprised, yung iba, 16 years na together, they never had intercourse. It's because of this. Sabi ko nga, ang swerte naman because hindi siya iniwan ng husband niya.
Yeah, kasi syempre
But-
may needs din ang
Yes.
male partner.
Right.
Okay, pero Doktora, does this also happen among sexually inactive
yes.
female individuals?
Right, kasi like what I said kanina, it's not only because of intercourse, right? Let's say you want to use a tampon when you have like menstruation, you cannot put it in. When you go to your doctor and have this pelvic exam yearly, hindi mapapasok yung speculum because it's so tight. Right? Yeah.
Pero Doktora, can this also happen naman sa, wala pang previous sexual experience?
Oh yes. Usually ang magko-complain ito, yung first, yung wala pang sexual experience. But this can also happen even if you are already sexually active and then you develop it in the future. So it can happen as well.
So it depends, since this is multifactorial.
It's multifactorial.
Okay. So kahit okay before, so
Yes.
di mo alam kung nagka-infection bigla, that's when,
Right.
kaya nagkakaroon ka ng vaginismus suddenly.
Yes.
And Doktora, meron bang iba't ibang klase ng vaginismus?
Yes, or actually different vaginismus. Kasi yung first is like just only in the opening, you know? Like what I was explaining kanina na yung iba pa nga even just to open her legs, they cannot do it. They will kick you, they will push you around. I've experienced it as a gynecologist
Nasipa
already.
ka na, Doktora?
Nasipa na ako. But of course, I have staff with me all the time.
Sana tinaasan mo na lang yung PF.
Hindi, but what I'm saying,
For
they
the
will
physical
really-
injury.
They will really try to push you away.
Yeah,
Meron
yeah,
mga
I
ganyan.
understand.
na kailangan talaga ng psychiatrist at the same time.
So this sometimes it would entail co-management with a psychiatrist.
Most of the time, because like this is part of the genitopenetrative disorder na nasa DSM-5. You know, the criteria for the psychiatrist to give the classification of the diagnosis for every condition. It's part of it.
Okay, so you mentioned about diagnosis, no? So, I mean, kasi hindi naman alam kung magkakaroon ng vaginismus on the first episode,
yeah,
right?
You'll never know.
Okay, so basically wala kang diagnostic measures here.
Wala.
But pagka nagkaroon na, and kalimitan, ewan ko, as I can perceive, this would be, the patient would be seen, the patients rather, kasi partner yan pag dumating sa ER because nag-lock nga during the sexual activity. Okay, so dadating doon for management already.
Right.
Okay, but after that, since magkakaroon, meron bang further diagnostic measures that you would subject the patient into?
Well, let's say, are you telling me na, let's say, kunyari merong pumunta sa ER tapos na they're locked, right? Of course, what do you do first? You have to separate them first, and you have to give muscle relaxant. And then after, you have to treat the woman, right? Check for any infection, any gynecologic problem. So you also have to check for STDs as well, or yung the usual is like fungal infection, right? Or any, of course, other issues that can happen in the vagina. But it's not only that, it's also psychological that you have to deal with.
Okay, so sabi niyo paghihiwalayin, that's the objective upon arrival in the ER. Okay, so, I mean, how long will it take? Hindi, una, why? Kasi,
you have to do it. Why? Because of the too much tightness, involuntary tightness of the vaginal muscles, okay? It can actually constrict the blood flow to the penis, right? And because of that, it can, mawawala ng blood supply and it can incarcerate. So, you really have to remove it.
So kahit anong nila, hindi talaga yan.
Hindi talaga. Kasi talagang involuntary contraction ng pelvic floor muscle.
Okay, so I understand the actual scenario. Okay, now, I'm sure makaka-relate ang mga dito, ang mga viewers, no, na parang, teka muna, pupunta kami ng ER, dalawa kami. Kasi syempre, what if you're in a secluded place where you did the activity? So, who would bring you to the ER and stuff? So, it would take some time eh.
Right.
So, basically, do we have like a golden period here of time na parang kailangan kasi pag beyond this time frame, pwedeng magkaroon na ng mag-necrose ang
so I think penis. What would be best is as early as possible you have to go. But remember with vaginismus, diba, there is actually involuntary contraction. So it's like saying na ang malaking possibility dyan, hindi nga makapenetrate eh. But I think what happened dun sa sinasabi mong scenario, there was pain during penetration, kaya naging spastic, right? Yeah, so that's different. But let's say 98 of the patients would have difficulty in having penetration. It's because of the contraction of the pelvic floor muscle.
Oh, I see. And ito, doktora, siguro upon arrival in the ER, so you mentioned about the muscle relaxant. So what other how do you go about the management apart from that?
Well, of course, you have to separate them first, right? So usually the anesthesiologist will come, or of course in the ER, they will give muscle relaxants. So after that, you have to take care of the woman too, right? And also, of course, the partner, because you have to check that everything is okay. But for the woman, of course, you have to do the gynecologic exam and also psychological examination too. And that's quite difficult. But, like, I'm happy, like, in the gynecologic point of view, I'm able to help a lot. Actually, I have saved 57 marriages already. I didn't know that it would help by this practice of, helping these women undergo this treatment, because I see them a lot in the clinic and I'm able to help them by addressing their gynecologic concerns.
So at least you've realized your purpose, in this practice, doctor, na marami kayong na-help. Kasi it's beyond this eh. It's the relationship of the partners, and then of course it comes also with the dynamics in the family, di ba?
Yes.
Yeah, and pero doktora, after dito, meron ba, ano yung role dito ng mga like physical therapy? Meron ba? Or
Okay, I'll tell you.
Some pelvic floor exercises?
Yes. There's so many treatments that we offer for this. Like for me as a gynecologist and a urogynecologist, what I do is, of course, I check the patient. Preferably, I check the patient with a partner so that at ease yung patient with me. And then after that, of course, I check the pelvic floor muscles. If I find that they're actually very tight and painful, you can feel it, parang merong shelf sa loob when you do a pelvic examination. What I normally offer is actually botulinum toxin injection. So I give
Just
the
like the
botulinum.
Botox na ginagamit sa aesthetics.
Yes,
yeah.
but the thing is, the dose is different, and it's like one dose, you have to give 100 units right away to relax the levator muscles. And then I have like physiotherapy, like biofeedback treatment, okay? What do you do with biofeedback treatment? There is a probe placed in the vagina of the patient, and then the patient will look into a monitor, and she will know when to contract and relax her pelvic floor muscles. And then, of course, after that, we also have the pelvic wand, or what we call the vaginal dilators, that I teach them on how to massage their vaginal tissues. And then they're okay, because like after botulinum toxin injection, after 1 week, mas relax ang pelvic floor.
So I never thought na parang napakarami na palang innovations now.
Yes, yes.
In managing this condition.
Right.
Okay, and Doctor, I mean after naayos na sila. Okay, so basically, but you mentioned about syempre may therapy, so this doesn't happen overnight. But of course, the co-management with the psychiatrist.
Yes, yes.
Yeah, I mean, meron bang mga how do you call that? Yung mga kanilang maintenance medications later on that we give them?
No, I don't give any, because with the botulinum toxin, they're fine already.
Yeah, kasi it causes like weakness.
Oh, it will
somehow.
relax.
Yeah,
And then after a week, it will relax some more. But sometimes, pag merong konting discomfort, we can give oral muscle relaxants na very tiny dose. Yun lang, you have to make sure that they don't drive, kasi baka mamaya you don't know kung kailan sila magiging weak.
Oh,
right?
yeah.
So as much as possible, I don't give it, because usually after the treatment, they're okay already.
Okay. Yeah, that's good. But you mentioned kanina na parang yung female would actually be subjected pa sa ibang therapy, di ba? Kasi kailangan din i-manage, ma-assess, ma-evaluate. Now, here, sabihin, mas longer ang treatment dito sa babae. Tama ba?
Well, I could say that because ang may problema sa vaginismus ang babae.
Babae, okay.
And I'm a gyne, so I deal with women only.
No, I'm just curious kasi here, so parang now, parang it comes to my mind na ano ngayon ang magiging role ng male partner?
Okay.
Para, the female is being managed pa.
Well, the male partner should be very, very supportive. Like yung consults with the doctor, examination of the patient. That is actually very difficult for the woman, right? So maganda kung nandyan yung partner. And then like, sinasabi ko sa inyo kanina, merong pelvic wand or may mga vaginal dilators. There are instances na hindi kaya ng patient gawin on her own because nakalithotomy position siya, right?
Yeah, yung lithotomy parang manganganak.
Manganganak,
yeah.
oo. So, mahirap yung gawin niya on her own. So, magandang nandyan yung partner, and both of them should help each other para ma-relax yung pelvic muscles. So, siya ang gagawa nun, yung pelvic wand and also the or use of dilators.
Medyo toxic, ha?
Hindi, kasi,
diba?
what is the objective is?
Yeah.
So, for them can have like, yung intimacy is improved, right?
Yeah, I mean, comparing dun sa parang walang problema nga and
Oo.
yeah. Pero doktora kanina, kasi syempre natuwa naman ako dun sa binigay yung stat na I was able to help
I know,
save
right?
like 57 marriages
Yes,
you mentioned. So, now here, doktora, I'm sure meron like, yun yung success nyo. I mean, yung with your help. Kasi nasa kanila pa rin naman yun. Pero, paano po yung meron ba tayong mga alam na stories? Kasi maganda rin i-share natin para at least, makapulot po ng aral ang ating mga viewers. Meron yung mga hindi po na work on. Meron ba kayo na relationship, because of that? Is it because they are currently under treatment pa rin?
Okay, ganito kasi yon. Because remember, this is genitopenetrative disorder, right? So what I'm saying, when they come to me with that same complaint, either meron silang vaginal spasm or vaginismus, I check on them, right? So when I check on them, pag nakikita kong it's because of like they cannot have penetrative intercourse, then you know already it's vaginismus, and the partner should be there ideally to help them. But there are cases na like what I said, hindi nga pwede mag-gyne exam right? So, yung amount or yung volume ng mga patients na nakikita ko with this, hindi ko masasabing yung iba hindi magiging successful, because I could say that it will be successful if they will undergo treatment. Yeah. And the treatment that I offer, I give the muscle relaxant. I can also do biofeedback or the pelvic floor rehabilitation. I have the vaginal wand or the different tubes, right, that you insert in the vagina to dilate and relax the pelvic floor. I have those So, more or less, kahit paano natutulungan
So basically,
pa rin sila.
medically speaking,
Kaya
talaga. So nasa kanila, pag gusto may paraan, pag ayaw, may
Pero
dahilan.
I think what would be very important for our viewers to know is they have to be, how do you say it? They have to know that this can happen so that they know that they can approach their gynecologist for this. Diba?
Yes, saka para wala na rin silang fear. Kasi minsan baka magkakause yun ng hesitancy in doing the act.
Yes, yes.
So at least kung alam nila. So kasi, paano doktora, meron ba tayong ibinibigay sa kanila ng mga outpatient na gamot? I mean, if ever there will be another... so talagang siya.
So ang maganda dito,
kinokontrol lang.
yes, once they're treated, they're treated.
Okay.
That is good about it, right?
So, talaga, so bihira dito ang recurrence?
Hindi, pwede ka mag-recurrence. Because like for instance, kunyari, elderly, na they're dry down there. Of course, you have to help them with the dryness. But in time, they can be dry again. So that's the time that you help them again. Kasi yung iba yung gyne problem na meron kang genitopenetrative disorder at iba rin yung vaginismus na
secondary
hindi ka magkaroon ng intercourse. So, mahi-help yun in a different way.
So it's a case-to-case basis kasi magkakaiba yung mga causes ng vaginismus. Okay, pero so having converse with me like ito sa mga topic na to, may stigma pa din. Can we say na may stigma pa din talaga na para pag pinag-uusapan ng ganitong condition? I mean, dito sa Pilipinas, kasi di ba dito nga hirap na hirap pag-usapan. Minsan, we cannot utter, normally lang yung parang mga like anatomical structures down there. So, meron pa ba?
I think there is stigma because a lot of people are very quiet about it. But I notice like in 2 to 3 years time, within 2 to 3 years time, dumadami nagko-consult sa akin for this So I think they're getting to be open.
Sumisikat ka na sa vaginismus, doktor?
Hindi naman, but what I'm saying is...
hindi kasi ako, doktora, I'm surprised, napakarami mong specialization. Sabi ko, ano ba ito si doktora? Sobrang sipag mag-aral, diba?
I know, because I'm a urogyne and aesthetic gyne too. So yan yung mga patients na napupunta sa akin.
Congratulations, doktora, napakarami niyo pong natutulungan.
Nakakatuwa yun So,
I know.
Yes.
And I can see you're happy with your practice, doktora. Pero ito, ano kaya yung mga tips na, pwede po natin i-share para mas maging open po yung communication sa mga mag-partners, parang tungkol po dito, especially yung mga naka-experience na.
Yes. Yeah. I think, pag may mga ganitong problem, you have to tell your partner that you have this condition because this will actually improve your relationship and also your intimacy. So, hindi kayo magkakasundo kung meron kayong issue ganyan So, if you know by yourself, I'm talking, let's say, to a woman patient, right? Na you have this problem. I think it's really good that you seek consult to your doctor, to your gynecologist, so that this will be dealt with.
Yeah, si Doktora here. Doktora Jenny. Doktora, ito may mga paraan. Pero may mga paraan ba para maiwasan po ang vaginismus?
Well, number one, how can you... Of course, you should not have, like, say, develop any vaginal infection because even fungal infection can cause irritation and inflammation in the vagina and it's going to be painful, right?
So, just be hygienic, but not
hygienic, yes.
Over-hygienic.
Number two, like menopause or perimenopause or dryness, lahat naman tayo pupunta tayo dyan So, we have to prevent that. Maybe you can use lube, right? Or make sure that you are well hydrated and also lubricated so, you can avoid that concern too, right?
So, basically, makakatulong dito yung talagang proper sexual education.
Yes, I think that is very good na, mas maganda kasi kung everybody will be very professional about it. And, you can talk about it with your peers and also with your doctor. Kasi wag mong iiwan sa sarili mo kasi may way to address it
Yeah, wag mahiya, no? And siguro, doktora, message tayo sa mga mga kababaihan na syempre, sabi nyo nga nadadagdagan yung inyong statistics. Pero nagugulat din kayo, di ba?
Yes.
However, ibig sabihin, marami pang iba na probably nahihiya lang. So, ano yung pwede nating mensahe sa kanila para hindi sila mahiyang magpakonsulta?
Okay, well, number one is, of course, you have to know your body. Prioritize yourself. You have to know what you want, right? And then after, that's the time that you seek your gynecologist if you have these concerns because it can be treated. Hindi ho siya nakakahiya. Sometimes, you can also have vaginismus not because you have issues, let's say, with penetrative intercourse, right? Like sometimes, let's say, you are the one who sits for a long time in a chair, let's say, in front of the computer, and you're trying trying to balance your body while seated, you know, your pelvic floor muscles can also contract in a different way, that when it tightens so much, then it becomes painful also during penetration.
Oh, okay, basta wag mahiya. And
Wag mahiya.
Para makahingi ng tulong. Ano, no? Yan ako, ayan mga kasambahay. Ang dami na naman po nating natutunang interesting at mahalagang impormasyon tungkol sa vaginismus. Naku, pero teka lang po. Hindi pa tapos ang usapan kasi paano kung may mga paniniwala pa rin na kumakalat na naku, wala namang basihan. Yan po ang bubuwagin natin sa pagbabalik ng Dr. Zon TV. Nagbabalik po ang Dr. Zon TV. Naku, oras na para itama ang maling akala at ilatag ang tunay na katotohanan. Dito lamang po yan sa Mythbuster. Dito po natin iisa-isahin, Doc, no, ang mga kumakalat na paniniwala tungkol sa vaginismus.
Okay.
At sasagutin niyo po ito, Doc, kung myth lang ba to or fact. So, pero kung myth po ito, Doc, naku, please explain kung ano nga po ba ang tama.
Okay.
Okay, so ready ka na ba, Doc?
Yes, yes.
Okay, so, Doc, ito, myth or fact? Kapag may vaginismus ka, ibig sabihin ay ayaw mo lang sa partner mo.
No, like what I said kanina, because I'm actually telling you not by what we hear, but what I read in books, right? And these are like scientific. No, it's not because you don't like your partner. There's really something happening. There's something happening in your pelvis. At the same time, there's something happening in your brain as well.
So, kaya dapat ma-evaluate properly.
Yes, yes. Tama.
Okay, so myth or fact? Normal lang yan, mawawala rin kapag nasanay.
Hindi eh, kasi remember may pain. And there is also tensing of your muscles in the pelvis. So hanggang sa hindi yan matitreat, wala mangyayari.
Kasi nakalak lang siya forever pag hindi nyo pinagamot.
Oo.
Okay, myth or fact, gumamit ka ng pampaluwag na herbal o langis, gagaling ka na.
Definitely hindi yan po pwede. Because remember, like what I said kanina, di ba? Pag mag-inject ka nitong botulinum toxin, hindi lang yung maliliit na amount. I need to finish the entire bottle when I put it. What I'm saying is malaki yung muscle na nagko-contract na hindi mo makontrol. So, hindi to kaya ng mga oil.
But, Doktora, on the side, basically, di ba kasi Botox works, yung maximal effect would be within 5 to 7 days.
Right.
Okay, so, I mean, is that the reason why you mentioned a while ago na magre-relax and then after a few days, mas magre-relax pa?
Yes.
Okay. Kasi
So,
nasa aesthetics din ako,
ayun na
Doktora.
nga,
That's why.
may instant effect muna siya. Pero after 7 days, mas maganda, mas relax. So, I tell the patients to come back after 1 week to re-evaluate them. But, you know, before sending them home, I give them vaginal dilators and wand already.
Oh,
Para mas ma-relax
okay.
pa.
So basically, kung yung Botox sa face, pang lift, di ba?
Oo.
Dito hindi lift ang
Hindi.
kailangan
You
natin.
need to relax.
Relaxation. Okay, so ito po, myth or fact, walang anak ang babae na may vaginismus.
Siyempre, myth yan, di ba? Hindi naman
Yeah.
kasi, it's not reasonable, right? Like yung statement na, you know, walang anak na babae ang may
Yeah,
vaginismus.
kasi it's a different, this is
It's a
anatomical
different-
issue and then
Yes.
sa, iba naman yun,
Oh,
di ba?
actually,
Okay.
wala pa akong narinig na ganun eh. Pero I'm sure, you know, you've asked me that, so I'm sure it's out. Yeah.
And there's always a first time.
Yes, yes.
Okay, so myth or fact, nakukuha ang vaginismus dahil sa kulam or sumpa.
Ay, hindi ako naniniwala sa ganon because, you know, I can explain it in a very scientific way, right?
Yeah. We have like studies to prove.
Yes, we have.
Okay. And then myth or fact, masakit lang ito kapag first time, kaya naku, tiisin na lang.
Hindi nga po. Kasi it's forever contracted unless it's treated. So, you know, unang-una, kailangan talaga maayos yan. You will only know na may problema once na-check mo eh. Right? So, I think, ang pinaka-best yung pumunta ka muna sa gynecologist so that ma-check. Kasi even like putting a speculum or just doing a pap smear, malalaman mo na kung may vaginismus ka. No? So, you don't need to have an intercourse for you to say na may problema kang ganyan. Actually, yung general check-up mo with your doctor yearly, makikita mo na yan eh.
Oh, okay. So ito, myth or fact, hindi na mahalaga kung hindi naman gusto ng babae maging sexually active.
Ay nako, remember, eto, hindi natin to ino-offer lang dun sa mga sexually active females. Like what I said, yung ibang mga patients, they use mga tampons. They're not sexually active, but they put tampons in. So, I think we have to address it too, right?
Okay, there you have it mga kasambahay. Naku, mas malinaw na po ngayon ang ating kaalaman tungkol sa vaginismus. At hindi lang po sa kung ano ito, kundi pati na rin sa mga sanhi, sintomas at tamang paraan ng paggamot. Tandaan ang kalusugan ng babae ay hindi dapat ikahiya o itago. Kung may nararamdaman na kakaiba, naku, huwag pong mag-atubiling magpakonsulta sa isang espesyalista. Ayan, maraming salamat Dr. Jennifer Marie Jose, an Obstetrics and Gynecology Specialist from Makati Medical Center sa magbibigay linaw at pag-alis po ng mga maling paniniwala tungkol sa vaginismus. But before we wrap up, Doc, any last reminders or advice to our viewers?
Ang best advice na mabibigay ko sa mga viewers, I think what will be very good is, we have to take care of ourselves and our body, right, and our health. So, I strongly advise that you seek your gynecologist for general checkup yearly so that, if you have infections, if you have problems with this muscle contraction na excessive, and also other illnesses, that can actually be addressed right away before it gets worse.
Basically, wellness check-up.
Yes,
okay,
wellness
wala
check-up.
kang nararamdaman. And you might want to invite our viewers to visit you here at Makati Med, Doctora.
If you have time and you want to have a checkup, we have a lot of gynecologists here in Makati Medical Center and we can address your concerns.
Thank you, Doctora. Yeah, and for more information about their services, visit the Makati Medical Center website at www.makatimed.net.ph. You can also conveniently book an appointment online or reach their 24/7 hotline at 02-8888-8999. 58 po yan, 39. Stay connected to world-class healthcare anytime. Or you can visit here at Makati Medical Center, your trusted health partner. Located at number 2 Amorsolo Street, Legazpi Village, Makati City. Naku mga kasambahay, para po mas marami pa tayong matutunan, stay tuned dahil magbabalik pa ang Doctors on TV. Welcome back mga kasambahay! Kanina po ay tinalakay natin ang vaginismus, isang kondisyon kung saan nagkakaroon po ng involuntary muscle spasms na nagdudulot po ng kirot at discomfort. Ngayon naman po ay tututukan natin ang isa pang isyong madalas baliwalain pero napakahalaga, ang vaginitis. Sa maling hygiene practices, pwedeng lumala po ang iritasyon, magdulot ng impeksyon at makaapekto hindi lang po sa kalusugan kundi pati na rin sa confidence ng isang babae. Kaya ngayon po umaga, alamin natin kung paano makakatulong ang tamang hygiene para makaiwas sa vaginitis at ang tamang management kung mayroong ganitong kondisyon para po mapanatili ang ginhawa at kalusugan ng kababaihan. Dito lamang po yan sa Women's Health.
Magandang araw mga kasangbahay. Ako si Dr. Ann Catherine Castro, isang OB-GYN at Maternal Fetal Medicine Specialist. Are you sensitive down there? Karaniwang kinahihiyaang ng mga kababaihan ang iba't ibang issue pagdating sa ating intimate part. Pero huwag kang mahiyang magpakonsulta sa doktor upang maiwasan ang malalang kondisyon. At sa episode ng ating Women's Health ngayong araw, pag-usapan natin ang isang common pero madalas na hindi naiintindihang kondisyon sa kababaihan, ang vaginitis. Ang vaginitis ay simpleng tawag sa pamamaga o iritasyon ng puwerta. Madalas itong nagdudulot ng kakaibang discharge, pangangati, hapde o kirot tuwing nakikipagtalik. Tatlong pinaka-common ang bacterial vaginosis o imbalance ng bakterya sa puwerta, ang candida or isang yeast infection, at trichomonas o isang parasite na nakukuha sa pakikipagtalik. Sa mga babaeng nasa reproductive age, halos kalahati ay nakakaranas ng bacterial vaginosis. At ang iba naman ay dahil sa candida or trichomonas. Kapag kaunti, malinaw o puti at walang amoy, normal. Pero kapag madami, mabaho at may kasamang hapde o pangangati, doon na kailangang magpatingin. May normal na good bacteria or tinatawag nating lactobacilli sa puwerta na nakakapagpanatili ng acidic pH. Pero kapag naistorbo ito dahil sa antibiotic, stress, hormones, or unsafe sex, dumadami ang bad bacteria o yeast. Unang-una, siguraduhin malinis pero wag naman sobra. Hindi kailangan ng harsh soaps or vaginal washes araw-araw kasi pwede rin itong makairita. So, mas ligtas ang banayad na sabon at tubig lang sa ari para ipanghugas. So, palit tayo ng underwear araw-araw at iwasan ang masyadong masikip na damit na hindi na makahinga yung balat. So, malaki po ang epekto. Halimbawa, kung may impeksyon, maaring makaranas ng pangangati, hindi komportabling discharge, or mabahong amoy na pwedeng makaapekto sa confidence, sa trabaho, at maging sa intimacy ninyong mag-asawa. Kaya mahalagang maagapan para hindi maistorbo ang quality of life. Healthy lifestyle po talaga. Kumain ng balanced diet, uminom ng sapat na tubig, regular na mag-ehersisyo at magpahinga, at iwasan ang paninigarilyo at labis na pag-inom ng alak. At huwag kalimutan, stress management. Kasi kahit stress, may epekto rin sa hormones at menstrual cycle ng babae. Kapag may kakaibang nararamdaman tulad ng paulit-ulit na pangangati, discharge na may kakaibang kulay o amoy, pananakit ng puson, or kung may problema sa regla. So, importante ring magpatingin kung may family history ng reproductive cancers para maagapan ito. Marami pong myths. Una, hindi totoo na dapat gumamit ng vaginal douching or paghuhugas sa loob. So, nakakasama pa nga ito dahil nadidisturb ang natural bacterial balance at acidic pH sa ating puwerta. Isa pa, maaring ma-push ng pagdudush ang harmful bacteria paloob ng matres at ang fallopian tube na maaring magdulot ng pelvic inflammatory disease at eventually kung ikaw'y may hirapan kang magbuntis or kung magbuntis ka man ay magiging ectopic pregnancy pa ito. Pangalawa, hindi rin kailangan ng special feminine sprays or deodorants. Ang natural scent ng katawan ng babae ay normal at hindi dapat ikahiya. Gusto ko pong sabihin, walang dapat ikahiya. Ang kalusugan ng babae ay kasing halaga ng kahit anong bahagi ng ating katawan. Ang pagpunta sa doktor ay hindi tanda ng kahinaan, kundi ng pagiging matalino at responsable sa sariling kalusugan. So tandaan, prevention is always better than cure. Sana ay nakatulong ang mga tips at info na shinare ko today. At kung may questions po kayo or gusto nyo ng personal consultation, i-message nyo lang po ako sa aking social media or bumisita sa aking clinic sa PCMC. Muli, ako po si Dr. Catherine Castro, ang inyong OB-GYN at Maternal Fetal Medicine Specialist. Tandaan po natin, lalo na sa ating mga kababaihan, that our health matters. Ingat at magandang umaga sa inyong lahat.
Ayan, mga kasambahay, naku, sana po ay mas malinaw na sa atin na ang kalusugan ng kababaihan ay hindi lang tungkol sa paggamot, kundi pati po sa tamang pangangalaga sa araw-araw. Maliit man ang hakbang, naku, gaya po ng proper hygiene, malaking naitutulong para maibsan ang discomfort at maiwasan po ang mas malalang kondisyon. Kaya naku, sa lahat po ng kababaihan at sa mga mahal nila sa buhay, magtulungan po tayo para mas maging healthy at confident ang bawat isa. And of course, gusto ko rin pong pasalamatan ng mga taong patuloy na nagbibigay po ng inspirasyon at suporta sa aming public service mission. Kuya Daniel Razon, maraming salamat po sa inyong walang sawang dedikasyon sa tunay na public service. And to BMPI's General Manager, Mr. J. Eusebio. May you both be blessed with good health and continued success. Siyempre, binabati din po natin si VP Nolly, VP Bong, VP Joseph, VP Jerry, VP Ruth, Doctors on TV Production Team, ang Public Service Department at ang KDR Group of Companies. And syempre, hi sa aking kambal, kay Iyo and kay Iya, hello. Hi kay EJ and kay Doc Alin, sa mga pasyente po natin sa Makati Health and Wellness Center. Syempre, binabati natin yung mga taga Delicates Food Corporation, headed by Mr. and Mrs. Jonathan Mooney, at ang mga taga Medical Depot. No? Thank you po kay Doc Vic Santos of Fatima Eye Center also. And Nanay and Tatay, I love and miss you both so much. And Nanay, happy birthday in heaven. Okay, and hi Tita Leti and Deng Duarte. Okay, at sa atin pong mga health partners, Doctors on TV would like to thank Capital Medical Center Incorporated, located at Quezon Avenue, corner Scout Magbanwa Street, Barangay Paligsahan, Quezon City. You may contact their trunk line number 02-8372-3825 or 02-5318-5100 or their mobile number 0919-069-1890 hanggang 91. You may also visit their website at www.capitalmedical.com.ph. Also, we would like to thank Soc Surgeon General Hospital. For inquiries, you may visit their website at www.sgh.doh.gov.ph. Also, we would like to thank River Valley Eye Center and Specialty Clinics Incorporated. For inquiries, you may visit their website at www.rivervalleyECSC.com. At kung gusto niyo pong balikan ang mga segments today o i-share po sa mga kaibigan ninyong healthy living advocates, naku, pwede po, just visit our social media pages, www.facebook.com/DoctorsOnTV and hit that subscribe button on YouTube at www.youtube.com/@UNTV News and the rest. Yun ako, para lagi po kayong una sa health info. At huwag pong kalimutang tumutok ulit, mga kasambahay, next Sunday, 9 a.m. dito lamang po sa UNTV. And also, don't forget to like and follow my Facebook page. Just type Dr. Sara Barba Cabudil in the search box. Muli po, naku, magandang umaga at maraming salamat sa inyong lahat na nakisama sa isa na namang makabuluhang talakayan tungkol po sa kalusugan. Ako po si Dr. Sara Barba Cabudil at lagi pong paalala namin, let's make it a habit to learn about good health. Only here at Doctors on TV.
Doctors on TV would like to thank Makati Medical Center, the hospital with the heart, located at Amorsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867, 02-824-9360, or you can email them at lgcsalesco@gmail.com. Pro Biomed Care Incorporated, PB Med Doctors Clinic, located at Parañaque City, Ruiz Building, 365 El Grande Avenue, BF Homes, Parañaque City. You may contact them at 0943-0533-040 or 0917-8967-955. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba Cabudil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Special thanks to Makati Medical Center, Dr. Saturnino P. Javier, Medical Director, Interim Co-President and CEO, Mr. Arnold C. Ocampo, Chief Finance Officer, Interim Co-President and CEO, Ms. Arlene L. Songko, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Punelas, Makati Medical Center Unit Head Manager, Communications and Special Projects,